and the trickle hopefully turns into a flood. Welcome, everybody. Welcome, welcome, welcome. We were very keen to start on time. And while we're waiting for the last few people to join, I'm just going to share my screen. So very grateful for Georgina Ram, who's helping us with the webinar, running everything and keeping everything running smoothly today. And then we are going to talk to you today about the abstracts. So that's myself, Professor Fraser Birrell, and Dr. Tommy Wood. Tommy, take a bow.
You want a physical bow? Hello.
Excellent. Excellent. We have roles for the journal. I'm the editor-in-chief and Tommy is associate editor. And then we'll also obviously have roles as trustees and on the abstract selection committee for the British Society for Lifestyle Medicine. If you have questions after this webinar or in the future, please feel free to email us on these emails. And those of you who are joining, I'd be grateful if you could also hook on to Mentimeter. Georgina's going to put in the chat the link, so you can just click on that link if you prefer to open a window on your computer. If you want to use Mentimeter on your phone, then just open up the camera and scan the little QR code at the bottom right, and that will link up to the relevant thing that we're interested in, because we want to make this as interactive as possible. Great stuff. So how are we doing? What I'm seeing is that there's 4 people have managed to get onto Mentimeter so far. 5, 6. How are we doing in terms of numbers? We've got at least 13 attendees. So choose your modality. Lovely. We are definitely getting there. We've got 8 who joined Mentimeter. And once we've got everybody on the platform, then we will get going and begin, because I'm going to ask you a few questions to begin with. So everybody's got access in the chat to the link for the Mentimeter. Everybody's had plenty of time to take down those email addresses. And what I'm going to do now is I'm going to share the Mentimeter screen so you can appreciate what we're looking at. And we can see that we've got decent interaction. So the first question is a simple one to give you a bit of time to make sure. Did you get onto Mentimeter? I'll give you a clue. If you're seeing that on your phone, the answer should be yes. But we're going to start simple, and then we're going to get simpler and simpler, because as Tommy's going to emphasize, great science is simple. Simple language, simple concepts. Right, so we've got 9 out of 9. There's nobody who's not sure. That is an absolutely fantastic start to the night. So moving on to the next question. Did you submit an abstract to last year's BSLM? Accepted, rejected? No, I'd rather not say. 7 who didn't. 8 who didn't. We've got at least 1 person remaining. Let's just leave it a little bit longer. Come on, I'm expecting the same numbers at least. We don't want dropouts. That does rather suggest that we've got the right people here who didn't submit and want to do it right. So that's fantastic. Obviously, we hope lots of people watch this on catch up as well. So at this stage, do you plan to submit to this year's? We've got 2 who say probably. We've got 2 who are not sure, and it depends. And I hope this is one of the things that it depends on. And then we've got 3 saying yes, properly. And at the moment, we've got 2 naysayers who at the moment are not in the camp. So you're here for your education, or because you just love either Tommy or I or Georgina. Okay. Great stuff. So This one is a free text, so you can type in a few words. What's the main thing you actually want to get from today? This is all about understanding what your own personal learning objectives are, so we know what you want. When you type in a few words, people saying the same words, it'll come in bigger and be more central. And if you just join slavishly every single webinar that the BSLM runs and don't have anything to say here, listen, we still love you just as much, but we will talk about the things that we think are important. So, nice big bold letters, you want the basics. So we're not going to take anything for granted. We're going to say, this is what an abstract should look like. We want simple, achievable. You want to understand what an abstract is, what it should have, what it shouldn't. Write concisely. Great. You're already picking up on the simplicity and the concision. Publishable. Yes, good point. Obviously, abstracts, because the posters are published and available through the website, that is a form of publication in itself. We are in discussions about different forms of publication, whether we should publish a separate abstract supplement for the journal, but we haven't organized that yet. I'm loving these comments, really. Writing in
great.
Meaningful science, and achievable is right in the middle, meaning that several people have said it. Tommy, what's your perspective on this? Are we going to be able to touch on any of this stuff?
Hopefully. I think we're planning to cover most of it. Absolutely. The process of writing an abstract is fairly simple. That doesn't mean it's easy, because we frequently see people who often, even very seasoned academics who don't always write a great abstract. But I think if you apply some of the basic rules that we'll cover, that will cover most of this, because it will be understandable, engaging, more likely to be accepted. You'll see the things that we're looking for as we go through the abstracts and we review them. So that should, tick off most of these things.
Brilliant. And while we won't specifically be talking about publication, the abstract is very much the first stage. Although the abstract is the only thing you submit to get your paper at the conference accepted, it is an very important part of published papers. And obviously, the top abstracts will be able to publish their data in the journal. So it's all about making sure that, recognizing that we can give you support, and we certainly helped mentor people to get their papers published in the past with some great feedback for that. So this is the first step, and we will help you along the way. Great. So we'll switch slides. So I'm going to stop sharing. And I'm going to assume that the others are letting us know if there's anything important that I'm missing in the chat. So we're going to share the slides now. Great. And of course, the meeting is going to be themed for people, places, and planet. And you should never miss a chance to show the logo. And these are what prospectively I felt might be our learning outcomes. The 4 important components of an abstract. That really is the basics. Understanding what each should contain, seeing examples of good ones. We're not going to show you any bad abstracts today. We only want positive examples, and then have any questions answered and be confident enough to submit. I'm going to pass over to Tommy now. He's going to address the next few slides.
Thanks very much. So, like Fraser said, we will start with very much the basics. How is an abstract constructed and structured? And these are the main 4 sections. And when you fill in the form online to submit your abstract, you will get prompts for each of these 4 sections that you will fill in separately. So we'll go over background, methods, results, and conclusions. And I have a slide for each of those and what we would like to see in those. And the word limit is 300 words, which you should sort of distribute across them. But most of that is going to be in your methods and results, and maybe 2 or 3 sentences each in your background and conclusions. So we can go to the next slide. So background, you obviously had some motivation for doing your study, and you should tell us about that. What is it that we need to know about your field so that we can understand the work that you did, and get some sort of orientation for the abstract. And that may be about the population, what's known, questions that are still outstanding. Maybe one sentence for each is a good way to think about that. And then a sentence to sort of lead us into the methods to say, well, what were your aims and objectives here? What were you trying to do? What was your goal? What were you trying to find out? And again, just a single sentence there should be enough. And as you put your, well, I mean, maybe as you design your study in the first place, but as you start to write up, there are a few things to remember, like how do we structure a certain type of study? And we see all kinds of abstracts, people doing all kinds of research, and that's great. Maybe you did an intervention, so we would follow the PICO framework. We'll talk about that as well. What's the hypothesis? What were you testing? What's your primary outcome? It could be an audit, but you have to compare it to some kind of gold standard, like a nice clinical guideline. And usually an audit might involve multiple cycles, and then you see what happened, you reiterate, you see whether that improves things again. And similarly, some things are a little bit more subjective, service improvement, other things that people have done or people are doing, but you need to provide us some idea of what your objective was and what your outcomes are and whether they're measurable, and how you looked at that. So for our methods, these are the things that we'll expect to see. Some idea of study setting, where are you? Primary care, hospital care? Is this medical students? Then your study population, this is your P for PICO. And either here or it can sometimes be in the results, the number of individuals or participants you included. How did you get this number of people? Where did they, where did they come from? How did you recruit them? And then some idea of the intervention, any comparison groups, so where the controls. So say, you've gone to the lofty heights of a randomized clinical trial, who's your control group, and what is your intervention, then what your outcome was and how it was assessed. If we're doing large studies with large numbers of individuals, you may be planning complex statistical tests, multivariable comparisons, adjusting for many things. So you might want to tell us about the other variables that were collected or secondary outcomes or other things of interest that you looked at. And in the methods, we would really like to see some idea of your statistical approach. So if you're comparing counts or proportions, you're doing chi-square tests. If you're comparing continuous variables, you're doing t-tests or man-Windner U-tests if you don't think your data are normally distributed. If you're doing large, complex statistical analyses, what's your model framework? What are you adjusting for? Things like that. We would expect to see that here. And again, this could just be a sentence, but some idea of how you analyzed or plan to analyze your data. Then the results. Usually you start with, again, any pertinent demographic details of your cohort, number, age, sex distribution, or other things that are relevant to the study that you did. And then, to the meat of your results. And again, depending on the study, there are many different ways to do this. But if you're doing some kind of statistical analysis, you're telling us about your groups, even if you're just doing sort of descriptive analyses, tell us something about the effect, what's the average and the range of the effect or effect size in your population. Are you comparing two means? Are you looking at an odds ratio or relative risk? Give us an estimate of the error. This will usually be some kind of 95% confidence interval, or, again, if it just happens to be descriptive statistics, giving us a range or a standard deviation. And then, some test of significance, so maybe give us a p-value from the statistical test you did. And again, you'll have set this up in your methods because you told us how you're going to do this, and then we'll be able to see that very clearly when you then give us the results. Finally, tell us what you concluded. So this can be a very brief summary of the findings. If there are lots of results and lots of odds ratios and p-values, sometimes it's nice to say, this is what we found in a few simple words. And what are the or what do you take away from the study? Sometimes people include references in an abstract. That's fine, particularly if you're referencing other abstracts, link them across, or if you're referencing prior work of your own or somebody else's that helps set things up or helps contextualize the results. That could be useful, and they can be included at the end. So then last little bit from me, these are some of the things that it says the audio is interrupted and breaking up. Are you able to hear me, Fraser? Okay.
It's breaking up for me, but I hope that was at my end. But
okay. If
a
anybody
long way
didn't,
away.
if there was anything that wasn't clear from what I said, from the slides, you can add that hopefully as a question at the end, and I'll come back to it. So this is the last slide for me. Just some of the things we've seen across the years, some tips on how to make an abstract that we really like and has a high chance of success. Try and format your abstract to the structure that we gave you. So often we'll see that people are submitting an abstract that it's very clear they've submitted it elsewhere for a different conference or a different group. And they're trying to shoehorn something into our structure and it doesn't really fit and it feels very awkward. So please do just try and rewrite some of those sections so they fit into that nice structure that we talked about for BSLM specifically, which is very similar to multiple other conferences, so it's not abnormal. Please don't just submit a PDF of a poster you already made for a different conference. That's actually happened a few times. We would very much like you to use the format that we provide because it helps us review it as well. Please do include your methods and actual results. That sounds, again, fairly basic, but you'd be surprised, it's happened several times that's not been the case. Sometimes we'll read a nice bit of background, some nice methods, we'll be excited for what's being done, and we'll see no actual results, no statistical analyses, and that really makes it hard for us to judge the work that was done. If you can, please include a table or a figure. This really helps us and the reader to understand your data. I personally like to show.
This is perfect because I'm not a big fan of
all the data if you can. Pardon, say that again.
I was just telling them when you weren't here that I'm not that keen on putting figures and tables in. They need to be good. There's no point including a rubbish figure or table. But if you can describe your data well in simple language, then do so. If a figure or a table really illustrates and adds, then please do include it. And you'll please one of the reviewers, one of three. Tommy really likes them.
I do like a figure. I think that if you make a good figure, the whole story is told in one go. And so that's why I like it. But that's also the comment that I made about, show all your data, make it a good figure. Because I agree, if sometimes people will just make a figure for figure's sake and it's a bar graph with a mean and a standard error for two different groups, and that tells us nothing really. So if you can make a good figure, that can really help you make a big impact. One final thing that's come up a couple of times is often we'll have people do one study and try and turn that into several abstracts, so-called salamying. We will spot it and you will get pulled up for it. So if you do one study, turn that into one abstract. If this is a very large study, you're doing multiple secondary analyses that are discrete, that's fine. But that's often clear based on the nature of the data, and you can reference and link to other ones if you need to mention them. But again, that's going to be usually for sort of larger study populations. Hopefully my audio didn't break up too much and all of that came across, but please do send any questions through. I can address them again later. Great
stuff. Thanks, Tommy. I'm not seeing any big questions in the chat at the moment, but I think Sarabika is going to tell us if there was particular issues. So I'm going to talk through hopefully 3 examples, and all I'm going to do is to show you what Tommy's talked through. So these are some of our very top abstracts. So don't worry if you're not doing studies of this size or length, but this was our top prize winner last year from Mellon Fellows. I'm using these abstracts with permission, by the way. So as you can see, you can read faster than I can, so I'm going to let you read through the background. But as you can see, in a few sentences, this background is probably a bit longer than average, really kind of building up the whole background and saying what the real potential advantages are. Essentially, they are saying this could be the solution to all the backlog in the NHS. So you can understand it takes more space than usual. Mostly you'll be able to do that in 3 or 4 sentences. And then you could argue that's a typo there, cross-disciplinary team, but this wasn't, we don't have a council of perfection. You know, it needs to be good. It needs to hang together. And what they said here was, we had quite an ambitious plan where we were creating a business case, getting funding, setting up, delivering and evaluating a totally novel whole system of care. I mean, it's a big thing that they did. And then people were surveyed, so we had data. Are there any questions on the background or methods before I move on? Because this wouldn't fit easily onto a single slide. You're happy with that? And then, you know, the top line is they had 100 participants from 9 GP practices. And, you know, this was delivered by different people. There was people who were from deprived wards. They were delivered virtually or face-to-face. And we talked about it being mostly women. So this is what Tommy was talking about. We want to know who the people were. This was mostly women, and therefore it might not be generalizable to men. And yet it was a good number of people. Groups were offered on a variety of different modalities with a focus on the lifestyle approaches. And then the key here is they didn't, although they got decent response to the survey, it wasn't anywhere near as many people who actually took part in the groups. So obviously, as long as you get a decent number of people giving you the results you're interested in, and they're representative of the wider group, then it's still a valid way, even if you don't have perfect, complete data. What was good was we had high confidence for achieving health goals. They thought it was useful, more time to explore and comfortable sharing, better able to promote. And then the free form feedback was all very positive. And then the conclusions are, you know, you can do this. They might deliver better outcomes, but you can see they're quite measured. You can only conclude on the data you've shown. So you can't conclude awfully ambitious things, but you see how carefully it's stated here. Group clinics may deliver better health outcomes, because actually this particular study, although lots of studies have shown better health outcomes, they didn't power it on that. What they were trying to do was to do something different. A lifestyle medicine model available to all communities, including the deprived, which they managed to include, and through virtual and face-to-face care, which is exactly what's needed during the pandemic. So overall, you can see there's the nice balance. We talked about the language is clear. You might argue that actually the language here is slightly more complicated than is needed. In general, you don't want to be losing any of the readers. And if you've done an abstract with a patient co-author, for example, it would be perfectly sensible to have much simpler language so that everybody who is reading and assessing the abstract has a clear understanding of that. Any comments about their first example? Group clinics. I'm not seeing anything in the chat. I'm hoping Georgina and Tommy are looking for hands. I'm just going to assume it's making perfect sense then. That's great. So we're going to have lots of abstracts just like that one this time, hopefully with your own original ideas. Okay. So second example. So this is from Hannah Findlater, who had done an elective period with me virtually during the pandemic. She was an Aberdeen University student and was able to analyze all the data from the BSLM diploma case reports. Obviously, very exciting time because the BSLM has just launched core accreditation, but this was based on the international board. And as you see, background, again, you can read through faster than I can. Pretty clear idea of what we're getting from this. It's a complete analysis of that period and providing novel insights. And then clear numbers in the methods in this case, because that wasn't a surprise. We knew how many people had submitted, so it becomes part of the methods in this situation. And then mentions the quality assessment tool that was used. Any questions about the background and methods for Hannah's abstract? Again, this was joint top prize winner for 2021. And then there were, you know, big numbers, lots of people, including lots of subjects, obviously focus often on obesity, but you know, some really nice outcomes that people had looked at, and it was possible to make some meaningful comparisons because of the size. Nutrition most frequent, 143, so about a third, including all. So you can see the style of it. In this particular case, although the numbers are big, there aren't lots of situations where you're making a comparison between, group and normal care, for example. So there's not much leeway here for putting in p-values of comparisons. But obviously, where you do make comparisons, we would expect that to be described in the methods and the results to be put either with p-values or 95% confidence limits, or both within the results section. And then it's important to make some conclusions. So the key thing is, how is this going to affect things? And obviously there were a few things that we felt were important from that work, because particularly if you're only including 1 or 2 patients in your PACE report, it's not going to have as much impact as if you're seeing people in groups and you can deliver lifestyle medicine in less time. You can see a little bit of a theme developing in the abstracts we've really liked. That's not because we are slavish about only liking group consultation approaches, but I guess there isn't anything else that really creates the time and space for lifestyle medicine in the same way. Are there any questions or comments about that second example? No? So example 3, this is the whole hog, and we have the abstract here, but in this case, I'm showing it in the context of the whole poster. So that allows you to see that this group, coincidence or not, that it includes Ellen Fallows again, as well as Paul Chadwick and Harry McMillan. Here in the background, this was at a time when it was really kind of headlines about Roy Taylor's DIRECT study, hitting all the papers. If I remember rightly, his book was actually serialized in the Daily Mail. So it was an important point of reference to mention that although the DIRECT study is very good, this is the powder meal replacement for white population, there may be better ways to reach the rest of the population. Because Momenta have been working on the diabetes prevention program nationally, which is now known as kind of Healthier You. They tried virtual delivery, including ethnically diverse populations. And obviously it's routine service delivery, but decent numbers, over 100, described who it is, how long they've had diabetes, that they're not on insulin. And here we've got males as well as females, but you can see they're very heavy. So if you've got a starting point and mainly ethnically diverse and mainly people from the lowest quintiles of deprivation, so very tightly linked into the background, these results. And although obviously in the poster they've chosen different ways to show that data, I think the numbers here are impressive in their own right. So I have to say, that's why I feel personally that for an abstract, you don't have to always put in figures or tables unless they add something. And then, the wonderful thing was, despite the challenges, virtual delivery of group-based intervention in this case worked again. So in this case, you've obviously got a chance to see a good poster. It doesn't all have to be in BSLM blue. You can choose the colors which fit the ethos. Your unit probably has a poster template that they like you to use, and they will be pleased if you use the template and upset if you don't. But doing a good poster is all about having a nice balance between text and graphics, and you should have appropriate references. In this case, they've got email contacts and they've got obviously websites as well. So any questions about that third abstract? So I guess what we're looking for you to do is to map your project and your abstract to the pillars, and whether you're using group consultations or virtual group consultations. So obviously these are the BSLM branded pillars: healthy eating, physical activity, minimizing the toxins, sleep, mental well-being, and healthy relationships. And then, as you've seen with the examples chosen, of course, these were the top prize winners, don't forget. What we saw is that actually virtual and in-person group consultations create the time and space to deliver those pillars. So it is worth thinking about that when you're designing your projects and writing your abstracts. At this stage, my plan is to take any more questions that you can put in the chat, or you can put up your hands. And then once we've answered any questions which are kind of free form, the plan is to go back to Mentimeter and gather a little bit of, answer a few questions about your experience of the webinar, or whether it's changed any, your approach at all to abstracts. I'm just going to stop sharing so we can see as many as possible. Any questions, or has it all been super clear? Listen, if we finish early and we have a half-hour recording, that's perfect for me. He's unmuted, but he's frozen.
Am I back?
You're almost back. You're very choppy again, though, so speak slowly and let us lip read. So we've got a question from Saloni, who's saying, where is it good to get data analyzed to put in the abstract? So the way you've asked that question is a little bit worrying, because in general, a statistician would want to be involved early when you're designing your project, your study. The ones that you approach now are going to be a bit upset because they might not like the way you've done the study. It might not be powered. You might not have collected the data that they would have liked. So in general, if you've got a home or a friendly university, they usually have data drop-in sessions. So it's a case of plumbing your contacts, reaching out, and making sure, and obviously if it's somebody who's peripherally involved, they're more likely to be able to persuade a statistician to do some analysis at this stage. We've had some really nice comments from Helen, who's saying it's been really clear. From Tanya saying super helpful. I was happy. Tell us a bit more about factors to consider for the methods and results sections for quality improvement service projects. Yeah, do you want me to take that one, Tommy?
Yeah, I think that's more in your area.
Yeah, so the key thing is how you classify your project determines what approvals you need to do it. So if you have done it as a service improvement project, which is usually to address a problem that you have or an opportunity that you spotted, and you can be honest about, you know, what it is that's led you to do that in the background, you will then have got approval. And although audit and service improvement projects are technically different, they're usually dealt with by the same department, which is often a different department to the R&D department where you take your research approvals. So the key thing is to follow the right model that you've got approval for. So you've done it as a service improvement project. Be clear about what the opportunity is or the barrier that you were trying to overcome, and describe exactly what you did. So I'm wishing that we'd included more models, but I think Ellen's example is quite a clear one with regard to service improvement projects. I think what you would often do is explicitly say in the methods that you got approval as a service improvement project and who from. And then in terms of results, you know, you want to show your best results. You want to show data that you've collected. So please don't submit abstracts if you really don't have any data yet. You might have to wait for the next meeting. But the key thing is, you know, it would be perfectly valid to say you had a goal to recruit, you know, 200 people and submit the data that you've collected for 100, say. That would be a perfectly acceptable thing to do. But you want to have data which is meaningful when you submit it. So you put in your best data. And if that shows HbA1c, you put it in. If it shows blood pressure, if you've decided on a primary outcome project for the project, which, I mean, service improvement might be feasibility. It might be that you've tried to show that you can set up a certain number of clinic appointments, or that you try to deliver a totally new model of care in some way. And if you've done it and done it several times in different places, then that has shown feasibility. So it's all about mapping your methods to the results, and for service improvement, meeting your initial objective. Does that answer your question, Sabia? Okay, good. And then we've got.
I can probably take this question from Shub,
Over to you.
who's a mindfulness teacher, led several courses for NHS staff, including doctors and trainees. What's the best way to talk about and present it? First of all, this is great. I love that you're doing that. Fantastic. It really probably boils down to what you would like to learn from the populations that you work with and how that could help others. So maybe, you know, in that kind of setting, you could provide a bit of information on what you do in your courses, but to sort of present a formal abstract, we might want you to collect some data from your participants. So we would like to know a little bit about them, their demographics, but then you could ask them, you know, some even just some semi-quantitative questions, Likert scale questions. You provide to ask people on a scale of 1 to 5 how confident they are about mindfulness before and after. Maybe you could follow up a little bit later and say, you know, how many hours or how many times per week are you enacting this after you've done your course? So maybe you could tell us, you know, before they were doing 0 hours of mindfulness, and then after the course they're doing, you know, 2 or 3 hours of mindfulness a week or something like that. You could collect some data there. So you could do, yeah, so both short and long-term stuff. You know, how do they feel before and after? Some of the things that you taught them, you know, are you able to follow them up and see how they're doing in the future? Maybe even some subjective questions about how that helps them address stresses in their lives or other things like that, how they feel confident about dealing with, which, you know, hopefully might like that. You can ask them some questions, you can quantify it, and then, you know, do some analyses if appropriate. I think that would be great. This sounds like you're doing very nice work.
Great stuff. Is that helpful, Shub?
So you have feedback forms, so that's a great place to start. Yeah.
Brilliant. Okay, so that's proven that you were all awake. And we've got positive evidence. Oh, this is nice. People are linking up. I love that. That's the wonderful world of the BSLM. There's a lot of love in the room. Great. So if there aren't any other burning questions, what I'm going to do is I'm going to go back to Mentimeter. And then if you guys make sure you're back on Mentimeter, you should be able to ask some more questions. So, asking you now, you might spot or you might not notice that this is the same question. Do you plan to submit to BSLM 2023? And we'll see how that builds up and whether we've got different answers. At the moment, we haven't got as many people who are actually on. Because I guess what we would hope to see is that there may be more people.
Maybe some people have moved from the no column to the not sure column, which still feels like positive.
It feels like an advantage. Just when he said it, no. Brilliant. Yeah, there's definitely been a shift, because if you remember, it was flat. Everybody was 2 across the yes, probably, possibly, and no. So we've shifted one person all the way from no to yes, possibly. Shifting the curve. This is the epidemiologist's dream. Fab. Okay, thanks for that. So what was the most valuable thing? This is a kind of free text entry one. So what did you think was the most valuable thing that we've covered today? Just in case we do something similar in the future. Clarity. Oh, great. You like the examples. I'm going to take that one, Tommy.
All right.
Clarity, I hope we both had. I hope. Oh gosh. So we have been clear. There's a clear theme. And
While these come in, Sarabika says, if you have two completely separate projects, would you be allowed to submit or present two abstracts? Yes.
Yes.
If they're two separate projects, absolutely.
They'll be judged on their own merits. So obviously, you're far better to do one project well than two projects badly. Because obviously we have a very limited number of slots for talks, and you're much more likely to win a prize if you've done something which is kind of high impact and makes a big difference. But if you really do have two good projects, that's brilliant. Great. So I'm liking the feedback. We have provided lots of examples and guides of how to write it. And if we can inspire and empower, all the better. I think that was all the questions we had for Mentimeter. So to stop sharing and we go back to our original slide set. Smoothly done, isn't it? So this is the things we thought were important. I think now everybody should have an understanding of those four components and what each should contain, rather, not complain. There'll be no complaints at all. You've seen examples, had your questions answered, and we hope we've shifted the curve a little bit, and hopefully the recording will also persuade a few more people to submit this year. So abstracts are just about to open, and there'll be a window for you to share your wonderful work with us. We'd really look forward to seeing your abstracts and hopefully seeing you all in